Over the course of several years, PHR has recognized that sexual violence cases are some of the hardest cases to prosecute. We started the program on sexual violence to bring together doctors, nurses, police officers, lawyers, and judges, psychotrauma counselors, and all the stakeholders who work closely with survivors to train them on the most effective ways to collect, document, and preserve forensic evidence of sexual violence to help support local prosecutions of these crimes.
The collaboration really that was brought about by PHR brought us together. We shared experiences, flashed out a number of issues that we thought that didn't quite work for us while working together.
Before my training with PHR, we had a lot of difficulties in the type of exhibits we were receiving from police officers, from health facilities, and we also had a very huge disconnect with the judicial system, who did not understand how to interpret our results or even what kind of work that we did here.
After the PHR brought us together, multi-sectoral actors, we were now able to work as a unit, whereby now if I have a survivor, I'm able to send that survivor to the next person using a phone call.
A survivor comes to the police station. We normally liaise with the health. We normally contact the hospital and inform them that we are referring a survivor to them. The same case applies even to hospital. Once they have the survivor at the facility and the same survivor, they are referring the survivor to us, they normally get in touch with us.
They also give them the reference number, they can call me, and we've just grown this way, and now it's just one big, huge PHR family.
I used to do my work here as a doctor, and I thought that it only involved treating my patients without due regard to other players in terms of those who manage these patients, for example. Once I finished with my patient in terms of treating, and that was it.
But PHR came in a very unique way, that we were trained, somebody from the judiciary, from the administration, children department, social development, Ministry of Education, civil society, health, all of us were trained in one class.
So they brought on the survivor's voice to the table. And the survivor's voice is able to guide them in their attempt in bringing together all the aspects of survivor support.
Sexual violence cases are about medical evidence, forensic evidence before the court. And any little gap in the statutory documents, any small challenges, any small lapses, of course, in our jurisdiction, will serve to the benefit of the culprit.
The basic training we had in May of 2013 highlighted systematic way of doing evidence collection, right from the clothing of the patient, the foreign material in the patient, taking samples like blood samples, other body fluids that might be useful in getting evidence.
Many survivors used to fear the police. They used to fear coming to report. So, but after the training, we changed the way we also handling our survivors who come to our facility.
We treat them as an emergency. Whenever they report, they are given first priority. And then the patient needs to be comfortable when you're examining, not the way we used to do before, whereby you just rush, force the patient to have an examiner, and then she leaves the place, but she's not comfortable with the service you have offered. So there's a big change with the way we're handling those cases.
By the time we were coming out of that training, we came out changed person. And we came out realizing that You cannot work alone on issues of gender-based violence. You need that other person, you need that other organization, so that you may be able to help the survivors. Through that training, we became friends, and I learned the value of cooperation. So I would say that after the training, my approach really changed, because I appreciated more the concept of multisectoral cooperation. So through our collaboration and doing things right the way they should be done, our women are getting justice.